The COVID-19 vaccine is now recommended for everyone 6 months of age and older. If you're anything like me and you have young children, you're asking, what does that mean for my family? How can I get my child vaccinated? Should I get my child vaccinated? So we've brought back Dr. Drees. Dr. Drees is our Chief Infection Prevention Officer here at ChristianaCare. She's been answering all of our questions throughout the pandemic, so she's the perfect one to answer all of our questions today. Dr. Drees, thank you so much for being here once again.
Thank you for having me back.
So let's start big picture. Some people may not understand kind of what came out over the weekend and what the current situation is with that vaccine 6 months and older.
Yeah, so the FDA just authorized for emergency use, and the CDC just recommended use of both the Pfizer and the Moderna pediatric formulations for that six months to 4 years or 6 months to 5 years, depending on which product you're talking about. So they are actively now recommended and authorized and should be available any day in the community and at your doctor's offices.
So how do parents choose between Pfizer or Moderna? Is it similar to just how we chose as adults when we were vaccinated?
Yeah, I mean, I think it's important to recognize that both the FDA and the CDC really, they were tasked with reviewing the vaccine on its own merits. They were not trying to compare one to the other. And the studies that each company did were slightly different. They had different lengths of follow-up, and the methods were different enough that it's really hard to look at like the vaccine efficacy numbers, for example. You can't really compare them head to head. Pfizer may be a little bit more of a known quantity since we've been giving it to older kids for some time now, whereas Moderna is brand new for the pediatric population. Pfizer is 3 doses really to get full protection. Moderna is 2 doses, so you might get your kid protected a little bit sooner with Moderna. It's likely that Moderna will have a 3rd dose recommended or authorized at some point in the future, but right now the primary series is 2 versus 3 for Pfizer. So they both appear to be very protective, particularly against severe disease in kids. So I think, if you only have access to one, I think there's no reason to hold out and wait for the other one.
So some people are questioning that efficacy when they say, well, if it's not, 80, 90%, I don't want it. But, is it better than nothing?
Absolutely. So, and I think, what people also, think is, well, kids don't really get sick from COVID. So why should I bother to get vaccinated? And the thing is, kids don't get sick from anything very often, right? I mean, they get lots of minor things, but they don't, it's uncommon to have a pediatric death, thankfully. But COVID in this age group is among the top 4 or 5 causes of death in kids. So it is, for a small portion of kids, it is very, very serious. And even those that don't die from COVID may end up in the hospital, may end up with multi-system inflammatory syndrome, which can cause many, many problems down the road, or long COVID. So it is not a minor illness for some kids, and it's worth, it's absolutely worth preventing. So no, I wouldn't wait.
So what about the side effects from these vaccines?
So again, both were compared with placebo, and there was, as we saw with adults, as we see with almost every other pediatric vaccine, there are side effects. There's pain at the injection site, which is the most common one, low-grade fever occasionally, but there was really nothing unexpected that was seen in these trials, and they each had between 3,000 and 6,000 kids in the trial. So that's not going to pick up rare side effects. But we now have, 18 months plus of experience with older kids and adults getting these vaccines. So I think there's really nothing unexpected that's shown up, nor that is anticipated.
So would you say the side effects are similar to the potential side effects of all of the other vaccines that kids get in their first year or 2 of life?
Yeah, I mean, there's really it's all kind of, babies may be irritable for a day or 2. All the side effects were mild to moderate, rare serious side effects like a febrile seizure, which again does not tend to cause any long-term effects, although it's understandably scary for the parent. But that was exceedingly rare. What everyone obviously has been worried about is myocarditis, because that certainly has been linked to these vaccines, and especially in adolescents and young adults. The myocarditis in young children is very different from what we normally see in adolescents and adults. Like the peak age for myocarditis that happens after, say, a viral infection is kind of your teens to early 20s. in the 5 to 11 group that has been vaccinated for some time, we're not really seeing myocarditis. We don't anticipate myocarditis to be a significant issue in these young kids because they don't typically get myocarditis after other types of infections. So I wouldn't worry. I wouldn't let that hold you back from getting vaccinated. And again, even in the older kids, it's exceedingly rare.
So let's dive into dosing a little bit. How does the dosing for these toddlers change from the dosing to the 11 and 12-year-olds and then dosing for adults?
Yeah, so it can be, from a vaccine administrator standpoint, it can be pretty confusing because there's 3 or 4 different formulations of each manufacturer, and they're all labeled differently. It's basically a smaller volume, so you don't want to put a lot into a small arm or a small buttock for a child. And it's also a different concentration. So, as long as the person administering the vaccine knows which dosage is appropriate for that age, it's fine. And I was going to say something else, and I forgot. It'll come to me in a moment.
So some people are asking, if they have a 5-year-old or they have a 6-year-old, and they're on that line, and especially if their child, maybe they have a 4-year-old who's the typical size of a 6-year-old, or a 6-year-old is the typical size of a 4-year-old. Do they wait? Does the dosing change? Kids are all sorts of different shapes and sizes. How does that work?
Yeah, so I just remember what I was going to say. So the Moderna dose is about 1/4 of the adult dose, and the Pfizer dose is about 1/10 of the adult dose. So it's all appropriate. And they did some initial dosing studies to figure out what exactly the right dose should be for each age group. But it is really based on age, not on body weight, because it's really about the maturity of the immune system. So if you have a child that's on the cusp of aging into the next level, go ahead and get that first dose in at the age that they are now, because there's no reason to wait, because the longer you wait, the longer it will take for your child to get fully protected. So if you can wait, get, like, say you have a 4-year-old now, get that 4-year-old dose. They turn 5 before the second dose, then they would get the 5-year-old dose. So it's really based on the age that they are at that moment that they're getting the vaccine.
And let's talk a little bit about, these older kids. If you have a 2-year-old who you're thinking about being vaccinated now, and you have a 7-year-old who has yet to be vaccinated, some people are still waiting, kind of holding out. What is your message to those individuals?
Well, again, I think people wait for different reasons, right? So some of them just don't want to be the first, but now we've had these older kids that have been vaccinated for some time now. Some of them felt like they didn't have enough information, especially with these younger kids. They're, with the CDC and FDA meetings these last few weeks, like, all that information is now out in the public. So we know a ton about these vaccines in this age group. So I think, we know what we need to know to kind of move forward. So I think, again, I think it comes down to a fear of side effects, which I think we have very strong safety data from each age group, as well as from now a 1.5 year experience with adults of what these vaccines do. I think there's a few people that are worried about long-term side effects, like months or years. Infertility is one that comes up. Obviously, that would be devastating should it happen to your child, but vaccines don't do that. The components of these vaccines, the mRNA dissolves or is broken down in your body in a matter of hours. And then the lipid coating that gets the mRNA into your cells, that's gone in a few days. So there's really nothing left of these vaccines to linger in the body to cause side effects, many, many months down the road. And vaccines historically, have never really caused side effects more than 2 months after the vaccine. And there's no, we certainly, I know infertility has come up for adults, as well as concern about infertility for young children. If we had seen infertility from these vaccines, given that we're, been using them now, we'd start to see the birth rate dropping, right? Because so many people have been vaccinated, and that's not happening. So given how, hundreds of millions of people have been vaccinated now, if that were a thing, we would have seen it by now. And there just really isn't a biologic plausibility of why a vaccine would cause infertility. So I would kind of put that fear out of your mind as well. And then, then the other reason why people might wait, again, is that I don't know that my kid needs it, because they're unlikely to be severely ill. And we've already talked about that. Even if it's a low risk, it's not one that's worth taking, I don't think. And then, you know, the other thing we hear a lot is, well, my kid already had COVID, so do they still really need the vaccine? And again, a lot of kids have had COVID, especially with Omicron. Omicron is not great at protecting against other variants or even some of these new Omicron subvariants. So people are getting Omicron again. And you know, if they had a mild case before, you don't know that the next case is also going to be mild. And we actually see the most robust immunity in people that have had both vaccine and an infection. Not that you want to try to get an infection for that reason, but people who've had both really have the strongest and broadest protection compared to people that were only had infection or only had vaccine.
So we have a submitted question from a viewer. With news of a new formulation that will better cover Omicron possibly becoming available in the fall, how do parents of kids under 5 weigh that with the possibility of our own eligibility for a second booster, for splitting the second dose for kids to have more time in between to best protect our families overall?
So I think, you know, again, these vaccines were based on the original virus. So we know that they're not as effective against Omicron as they were some of the previous variants. But that said, we know that they also provide good protection against severe disease and hospitalization and death. So I would go ahead, you know, and get the primary series in now, you know, the 2 or 3 doses. Moderna, I know, is working on that combined Omicron and original booster. So a kid who gets vaccinated with Moderna now might be eligible for that 3rd dose to be that bivalent vaccine. So I think, and that would be very excellent timing kind of going into the fall, not knowing what's going to happen with whether it's going to be more Omicron or something new coming up. So I wouldn't hold out for that vaccine, you know, and leave your child unprotected in the meantime.
So another submitted question we received: how does this compare to other pediatric vaccines in terms of the rollout, length of study? You know, kids get so many vaccines in that first year of life. Should this really just be on that list?
You know, I think it should be. I think, you know, COVID's not going away. And if you look at other diseases that we routinely vaccinate kids against, hepatitis A, chickenpox, rotavirus, and you look at kind of how many deaths those diseases caused before we started vaccinating, they actually were lower than COVID. So, you know, we routinely give vaccines for many other diseases that have a lower risk than actually COVID does right now. So, you know, putting it all in perspective, I think, is really important. Now, of course, these vaccines are authorized for emergency use, not yet fully approved, and that's really just the duration of follow-up that has yet to be accomplished. And it's a balance between one, you know, some parents feel like this should have happened months ago because they've been waiting for their youngest kids to be able to be vaccinated. For others, it feels like it's too soon. So I think the FDA tried to strike an appropriate balance, like they did for adults, getting the vaccine out there to a vulnerable population to prevent disease and death. And then as we accumulate more follow-up time, they will be fully approved. So yes, it has been accelerated, but again, with all the standard safety protocols, you know, the methods of these studies were similar to what's happened with other pediatric vaccines that started in adults in terms of kind of how they looked at immune responses and that sort of thing. So I think, you know, they followed all the correct steps in terms of testing these.
So let's talk a little bit about that difference. I know we talked about it when the adult vaccines were first rolled out. What does emergency use authorization actually mean, and when do you think it'll be fully approved?
Well, you know, again, for adults, we saw the emergency use for both Pfizer and Moderna happen in December of 2020, right? So very, very rapidly. And then it took about six to 9 months to get kind of their full approval. And that was really just to accumulate more data of follow-up. Traditionally with a vaccine, the FDA wants at least 6 months of follow-up for all the recipients. Doing that in the midst of a pandemic when people are dying and being hospitalized is not, you know, there's a loss there. So it's really about balancing kind of getting enough data to feel comfortable. And that's with, again, 2 months of follow-up on average, because most vaccines traditionally cause any side effects that they're going to cause within 2 months. And then allowing them to move forward while we're gathering, you know, there's tons of safety and efficacy data being looked at in the real world now that millions of people are vaccinated as well. So it's not like once they're authorized all examination stops. Like we've been continuing to follow how these vaccines are performing in the real world, both from safety as well as from an effectiveness standpoint.
So let's talk a little bit about situational safety. So I know we've also had this conversation a lot over the last 2 years of, COVID is high in the winter, COVID is down in the summer. Where are we right now? Is it a good time to get vaccinated? Or some people are thinking it's the summer, COVID's gone, it's not a problem. Where actually are we right now?
Yeah, so we saw the big surge in the wintertime with Omicron, and then we saw a smaller surge back, in April-ish, that didn't reach the same levels, but we certainly saw increasing, and it was mostly driven by these Omicron subvariants that are kind of evading the immunity that people have past infection as well as from vaccines. And so we've seen a little bit of a stabilization there, but we're still seeing 100,000 new cases a day, and those are only the ones that are actually reported. So I'm sure it's much higher than that with home testing and everything else. We're seeing roughly 4,000 hospitalizations every day across the US, and we're still seeing about 250 deaths every day in the US. So yes, the numbers are much lower than they have been, but they're still significant, and even when it's summertime. And so, we're all kind of anticipating once people start to go back indoors again for the fall and winter that it's gonna, surge again. And so now's the perfect time to get your kids vaccinated, get yourself vaccinated and boosted if you haven't already. There likely will be another booster for adults recommended in the fall. We don't know yet, but that's anticipated. And so, getting kids kind of fully up with all their vaccines, not just COVID, kind of going into the summer and into the fall is good timing.
So those who have the 3, 4, 5-year-olds who are old enough to have been wearing masks to protect themselves, what is your message about continuing to do that even if they get the vaccine?
So, you really have to look at your own situation, right? So I think, especially those people that have young children and have, immunocompromised or elderly grandparents or other people that they want to spend time with, I think vaccinating kids is a great method to help protect everybody in your family. And you really have to look at what's happening in your own community right now. We've started to see, all of Delaware was high community level, and we're starting to recede from that a little bit, but we're still considered medium. And so it's, when there are situations like going to the store, places where, masking is still, may be advisable, just because we're not seeing, we are still seeing a fair amount of transmission. But when you're outdoors, when you're around people that are vaccinated, then you can probably relax a little bit.
So Dr. Drees, full transparency to our viewers here. You and I have been talking about COVID for 2.5 years. Time escapes us now, doesn't
Yes.
it? But, we talked when I was pregnant, you advised me to get the vaccine. Now my child is 7 months old and we talked about the importance of him getting this vaccine. So I think honestly that I'm just very lucky to have this access to you. And I love sharing your information with our public here on Facebook Live. So talk to those new moms and those moms of toddlers who are watching this. And what is your message to them to reassure them today?
So, I think, kids are at risk. Kids will remain to be at risk, whether it's preschool or school or daycare. And to do everything you can to protect your kid, makes the most sense. We're here professionally in our job roles to talk to people. But you're a mom, I'm a mom. My son is older, but we would never tell people to do something that we ourselves would not do for ourselves or for our children. So we're here really just to spread that message.
Absolutely. Dr. Drees, as always, thank you so much for that information. And if you are watching and have more questions about the pediatric vaccine or really anything else COVID related, please leave those questions in the comments. We can chat with you in the comments after this live is over. And also visit ChristianaCare.org for more information about where to get your child vaccinated, how to get yourself vaccinated if you aren't already, and any other COVID information you may need. Thank you all so much and have a great day.